What's pleurisy?
Okay, so pleurisy is inflammation of the pleural sac of the lungs. Now, it's important for us to know the anatomy first, right? So the pleura is a sac that surrounds the entire lungs. It has two layers, the parietal and the visceral pleura. The parietal touches the actual lung tissue, the outside of the lung, and the parietal touches the intrathoracic cavity, right? And so it has fluid inside, serous fluid, and what it does is it lubricates as we breathe in and out and the lungs expand and recoil. It creates lubrication, which allows us to breathe adequately with no pain. Pleurisy is when that membrane is inflamed. It can be caused by bacteria, viruses, fungus in some immunocompromised patients, or even metabolic waste when you have liver or kidney issues that cause irritation. So we have to fix the irritation. We have to control the issues with shortness of breath and dyspnea, because these patients have inspiratory pain. When they breathe in, it hurts them because the lungs expanding and it's grinding against that inflamed pleural membrane. So we have to deal with that first. We have to make sure that we provide adequate respiratory interventions. We have to sit the patient in a high phallus position, things like that. If that's not fixed, the patient may now develop pleural effusion, where instead of it being just one section of the pleural sac that's inflamed, now the entire membrane is inflamed, and this causes severe pain. The patient's going to have dyspnea, shortness of breath. We have to give them nasal cannula. We have to give them some oxygen, because the patient's going to have a hard time breathing. And remember, the cannula or the massage just depends on their oxygen saturation. If that's not fixed, then the patient may develop something called empyema. And empyema of the lungs is when you have an accumulation of fluid in the sac. Now, keep in mind, guys, this is really important. That fluid is not inside the lungs. It's collecting inside the sac that surrounds the lungs. So when you auscultate, you're not going to hear crackles. You're going to hear diminished breath sounds. You're going to hear absent breath sounds, because that lung cannot expand because that fluid is putting pressure against the lung. So it's important that we understand the difference between the fluid accumulating in the sac as opposed to the fluid accumulating inside. This patient's not going to cough up any fluids, because the fluid is confined outside in that membrane, in that sac, but that's limiting lung expansion. So these patients require a thoracentesis. That's when you sit the patient in a high phallus position, you put their arms over a bedside table, and you expose the area that the doctor's going to insert the needle. You educate the patient to not take deep breaths or to not cough as the needle is being inserted, because if the lung expands too much and the needle touches it, it might pop, and now you have a pneumothorax. It's important for us as nurses to assess the respiratory breath sounds before and after. We know that the procedure worked because before the procedure, there would be diminished or absent breath sounds. But then after the procedure, we have now, we have breath sounds. We can hear the air coming in and out. So it's important for us to continue to monitor those particular assessment parameters. And in essence, that's pleurisy, pleural effusion, and empyema.